Welcome back. Thank you for staying with us. Members of the public have chosen to air their concerns for the disregard shown by fellow citizens for the protocols put in place by the government to contain the spread of COVID-19, with many living with chronic diseases which make them more susceptible to the virus. Others are choosing to stay home to protect their loved ones. People island-wide have raised their voices on the effects of irresponsible behaviors that range from breaking curfew to not maintaining social distance.
Given recent developments in the local COVID-19 situation, including the implementation of a curfew and social distancing protocols, it was believed that the gravity of this situation would be enough to cause members of the public to abide by these rules. However, due to a recent social media trend of persons taking videos of them in large social groups and outside in the streets beyond curfew time, it is apparent that this is not the case. Various members of the public have chosen to share their voices with us here at Hot 7 TV about their take on this situation, many of which suffering from chronic illnesses which make them more susceptible to the disease. It was noted that a large majority of perpetrators to date have been male, and as such, we have chosen to highlight their opinions in this report. Here's what they had to say.
I choose to follow the guidelines and stay home, mostly for the sake of my friends and family. I have friends and family who already suffer from respiratory illnesses and weak immune systems, so I really don't want a case to rise where I already have it from going outside and don't check that and pass it on to them and they actually feel from it. So I stay in as much as possible for the sake of my loved ones.
Okay, so I'm from the community of Grand River, and I basically decided to stay home because there is a possible in-community transmission of the deadly COVID-19 or coronavirus. I live with persons above 70, two of them actually. So I think it's imperative that I do my part to protect them because, like they say, it kills mostly people. It affects more people over 60, and therefore, so I'm just staying home to do my part, protect my family and protect the general populace. I hope everyone does the same. It's a real virus. I see people outdoors still not paying heed to social distancing, and I mean, it is what it is. Everybody has to learn for themselves, but I'm just doing my part because I got family to take care of and myself to take care of.
Okay, given the fact that I fall under the category of person with anxiety, and given my work, the work that I do, the place that I am, it's just scary. It's really scary because I'm at the gateway. I'm literally at the entrance of where the infection could come into my home through me. Like I could be the vessel. So that's really why I stay home, because the health of my family is more important to me than just going to work and not caring or being selfish or saying I won't get it. It won't affect me. It won't affect me. Yes, that's true. But it could be on my shirt, or it could be on my pants, or it could be on my pass when I come home. And then when I come home, my mom or my dad hugs me or touches me and asks me how's my day, and then that's how they get it. That's the anxiety part. That's the anxiety part of this whole thing, and the fact that people they aren't taking it seriously, or they're going in with that mentality where they think they won't be affected. Yes, that may be true. You won't be affected, but someone close to you might, and you might be the reason that they got the sickness. And then that's not something that I think anyone would want on their conscience.
Okay, so based on the situation and the gravity of it, and I think it's something that we have not seen happen in the world on this level, with something that is that can actually spread like wildfire. I mean, we've experienced a lot of things over the years, but nothing like this. I think for me as a father, it really it plays a major role in also teaching not only yourself and your kids what you should do in particular times. And I mean, the adherence to what the government has put out there, the social distancing is so critical. So I think the reasons that I have stuck to it, as hard as it may seem, is the fact that I have two daughters who are both asthmatics.
As a bronchitis patient myself and a sufferer of anxiety, I would like to take this moment to ask members of the public to be a bit more responsible and to abide by the protocols put in place by local government for their own safety as well as the well-being of the wider population. For Hot 7 News, I am Jacqueline.
Concerns have been raised by the public as to whether the police force has enough manpower to ensure that the waters are guarded 24 hours. One fisherman has suggested that the police join forces with fishermen to ensure border protection. Genevieve Gonzague tells us more.
Fisherman Christopher St. Prix says honest fishermen like himself want to be a part of the solution and not a part of the problem in this COVID-19 fight. He has volunteered his services to work alongside the Marine Police to help guard our waters from those seeking to smuggle people in under the cover of the night and thereby placing the country's health at risk. He is proposing that the Maritime Police join forces with the fishermen to ensure effective guarding of the coast and the water.
My take on that is really, I think the government, especially Coast Guard, don't have enough to be able to manage our waters. They don't have enough equipment. They cannot cover so much ground. We could get maybe 2 police, a few policemen on each of our vessels, and they put us at work and we tow in the coastline, helping out the Coast Guard, and we get a little something at the end of the day too. So I think, we're supposed to work now with the Coast Guard to make our shores, our country more safe.
St. Prix says things are considerably slower in the country since non-essential businesses have been closed and people are being urged to practice social distancing. Thus, fishermen have not been going out that much.
It's like since things are slow on the island, we're not going to see that much. They should at least give the fishermen a little break.
The fisherman says an all-hands-on-deck approach is what will ensure the safety of the nation and contain the spread of COVID-19. Reporting for Hot 7 News, I am Genevieve Gonzague.
Meanwhile, another local fisherman is asking for allowances to be made under the curfew law as many fishers go out to sea before 5 a.m. to ensure their daily bread. He's also calling for stricter measures to be put in place when issuing licenses to fishers in light of boat operators facilitating illegal entry into the country despite the borders being officially closed. He says honest, hard-working fishermen are paying the price for these unscrupulous boat operators.
Social media has been awash with videos of people entering the island through the back door. These occurrences have sparked concerns about potentially infected persons coming to the country undetected. For this reason, Acting Police Commissioner Milton Daisy has assured the public that the borders will be guarded 24/7 by Marine Police. Fisherman Dennis Shotman Sylvester is urging boat owners and operators to cease the illegal practice of bringing people to St. Lucia's shores. He says it reflects badly on legitimate, hard-working fishermen. He is also asking for there to be a deeper investigation before the handing out of fishermen IDs.
They have guys that doing the country ban, doing all kind of things. When they go astray, they get stranded. The media saying he's a fisherman. The fella don't have no line, he don't have nothing on board his boat to show that he's a fisherman, not even an ID. And the fisheries need to be certain that whoever that come to them for an ID stating that there is a fisherman, they have to investigate that person. Don't just give people ID and saying it's fishermen not there. They need to work on that. Don't do that stupidness. Because a lot of these fellas that doing all activities, claiming they're fishermen, and they're not. They're making me look bad. They're making other good fishermen look bad. We need that stop.
Sylvester applauds the revised curfew of 8 p.m. to 5 a.m., but is asking authorities to consider honest fishermen who have to be at sea as early as 3 a.m. to be able to feed their families.
Very good thing Mr. Chasney figure out to do. From 8 o'clock to 5. The only thing I want Mr. Chasney to do is give fishermen a break. Honest fishermen that go in and earn a living. That live in here from 3 o'clock in the morning and go into sea. That's fishermen that don't want to do nothing out of the way. Legit fishermen. Give them a break, give them some pass so that when the Coast Guard meet them, the Coast Guard could recognize, well, yes, that's a legit fisherman and that's what he does for his living. Give him that pass, he could go and do his business.
The fisherman says the government is doing what it must to protect the country, and the onus is now on members of the public to do the rest.
There is some hungry fishermen that go in and take people from Matnik and bring in St. Lucia, trying to destroy here. When they finish, they want to blame government, things hard. Who making things hard? We making the thing hard here in St. Lucia. You go in by the market, the people want to sell free limes for $10. So who making it hard? We making it hard. When they finish, they want to blame government. Government doing their business. You yourself do your part too.
He cautions that a few extra dollars is not worth the health and safety of the entire country. Reporting for Hot 7 News, I am Genevieve Gonzague.
Deputy Chief Environmental Health Officer Cheryl Eugene St. Romain, in a press statement, appealed to the public to respect and follow the protocols set with regard to social distancing. Genevieve Gonzague reports.
St. Lucia to date has confirmed 9 cases of COVID-19. The public has been asked to practice social distancing. The country is on a partial shutdown. Stringent measures such as an earlier curfew and the suspension of all liquor licenses have been implemented in a bid to ensure that COVID-19 is contained. Deputy Chief Environmental Health Officer Cheryl Eugene St. Romain assures the public that it is working tirelessly to protect the public and is urging the public to work alongside them to successfully reduce the impact of COVID-19 on the nation.
The Ministry of Health and Wellness supports the introduction of the national scale down, which was put into effect to support the establishment of social distancing on Monday, March 23rd, that has now been extended to April 14th, 2020.
Many persons continue to disregard the practice of ensuring 6 feet of distance among themselves. Eugene St. Romain highlights the importance of such a practice and is imploring the public to make this a habit.
We have observed that in practice, the recommended 6 feet distance is not being maintained, especially when persons queue for service at institutions and business places such as supermarkets, banks, etc. To this end, we wish to implore the public to adhere to those measures. By maintaining the recommended 6 feet distance, you reduce the likelihood of getting infected or spreading the virus when people around you may cough, sneeze, or make physical contact.
The Ministry of Health and Wellness is advising the public to follow all protocols set out by the government, particularly social distancing, as it is for the safety of the nation.
Limit the number of trips to the supermarket and places of business. However, when you do go, always maintain 6 feet distance. You should also avoid touching surfaces such as railings, doorknobs, counters, etc. Always keep with you hand sanitizer, and at the earliest opportunity, wash your hands with soap under flowing water for 20 seconds. Avoid getting together in groups. Ensure, upon return to your home, that you wash your hands thoroughly before engaging, using the adopted protocol established before engaging in any activity.
The Ministry of Health and Wellness notes that such interventions are of great importance as they serve primarily to mitigate the spread of contagious diseases and, in this case, COVID-19. Reporting for Hot 7 News, I am Genevieve Gonzague.
In a bid to continue providing primary health care within local communities while keeping to national COVID-19 protocols, the Ministry of Health has announced the immediate restructuring of the delivery of healthcare services at various healthcare facilities. Several health and wellness centers will cease operations to allow staff to complement the faculty of the newly established respiratory clinics and respiratory hospital. While several services will be halted, new social distancing initiatives will allow chronic patients to utilize services through an appointment-only system. Shaka Wooding explains.
The national COVID-19 protocol has seen the establishment of 5 respiratory clinics, several quarantine sites, and 1 respiratory hospital in an effort to strengthen local response to the threat of COVID-19. The arrival of 113 Cuban health practitioners will greatly supplement the workforce of these facilities. However, the Ministry of Health has identified the need for more manpower to be delegated to the various sites. In order to accomplish this, the ministry has announced the closure of several community health facilities in order to allow staff to be redistributed to the various respiratory sites. As announced by Assistant Principal Nursing Officer Telka Jabaptis, 17 facilities will be affected.
The healthcare facilities in the various communities as follows: Moshi, Lage, Fontaso, Tiroshe Castries, Monrepo, Tiroshe Mikud, Bellevue, Grace, Saltibus, Delse, Mogouge, Etangs, Font Saint-Jacques, Jacmel, and Vanna. The scaling down of the health facilities forms part of the ministry's response plan.
Healthcare services have been redirected to the other wellness centers, which will remain open. Jabaptis announced a halt of various specialty services.
To ensure that we protect our clients, especially the vulnerable groups, some specialist clinics have been suspended until further notice. These include the Sexual and Reproductive Health Clinic at Victoria Hospital, the Cuban Eye Health Clinic, Dermatology, Podiatry, Community Pediatric Clinic, Obstetric and Gynecology, Diabetic Retinopathy, and Child Health Clinic. Antenatal clinics will continue, but by appointments only. The Hanson's Clinic will continue on Wednesday mornings at the Castries Wellness Center.
Routine dental services have also been suspended. However, a limited emergency service will be provided at Babono Wellness Center, Denry Hospital, Ancillary Wellness Center, and Viewfort Wellness Center. Patients are asked to call ahead of their arrival for scheduling as social distancing is in effect. For Hot 7 News, I am Jaka Wooding.
This is the Hot 7 TV Nightly News. Stay with us. There's more coming up after the break.